Hey there, this is Dr. Renfrow, and I just wanted to say a few words about this short slideshow from the waiting room. The first slide here says upper cervical care is more about how you are healing than how you are feeling. This doesn't mean we don't care about how you feel or your symptoms. It just means that upper cervical care is not a feel good immediately treatment or therapy or any of those medical types of words. Um, I hate to break it to you, but there's no such thing as a quick fix. There's no such thing as a quick fix. The only quick fix I'm looking for is maybe a coffee, maybe a puppy, as long as I don't have to take care of it. Seriously, upper cervical is a corrective health restoration and maintenance service. Obviously, most people come to us with symptoms, but we have to address what's causing the symptom and not just treat the symptom over and over and over again, because that would be insane. That would be the definition of insanity, doing the same thing over again and expecting a different result. The practice of treating symptoms and disease is actually defined as medicine. And so we don't practice medicine. What we do is practice chiropractic in a very specific, very awesome field of chiropractic called upper cervical care. And what that does is restore health through the relationship between the spine and nerves, regardless of the symptoms. Because remember, whether you have symptoms or not does not determine how healthy you are. And part of the problem with our healthcare symptom is that we determine how healthy we are based on our symptoms. And this is why people end up with some of the leading killers in our society: heart disease, cancer, stroke, and they've had internal health crisis going on for a long time, but because they did not have symptoms, they thought that they were healthy. Anyway, the Journal of Neurological Science puts the health picture this way. This is what the Journal of Neurological Science, again, a medical journal, says that health is based on. They say that the quality of healing is directly proportional to the ability of the central nerve system to send and receive nerve signals. So basically, that means that your health is determined by how well your brain and your body can communicate. So if your brain and body can communicate very well, regardless of whether you have symptoms or not, then you're going to be healthy. If your brain and your body cannot communicate well, then you're not going to be as healthy as you could be, and you are in the process of developing symptoms and conditions in time, because it all takes place over time. So whether you like it or not, your health and the conditions that you develop, the symptoms that you develop, whether you have them or not, what you will have in time, are based on the health of your spine and nerve system. Next slide says holding is healing. This is very, very important. Very important. Basically, the adjustment that I give my patients is not what heals them. I don't have any magical power in my hands that allows me to touch somebody and then they magically heal. It's not how it works. How it works is that this brain to body communication that we're talking about that determines your health can be limited by a condition in the spine called a subluxation. And when there's a subluxation in the spine, it's occluding an opening where nerves pass. It's strangling a nerve and decreasing the function of that nerve or nerves, nerve fibers, networks of nerves, the nerve system in total, to be completely healthy and to communicate normally, to facilitate the communication between the brain and the body. Where was I? Oh yeah, back to holding. So the adjustment unlocks the spine by correcting subluxation. And this restores balance back to the body so that the brain and the body can communicate better. See, the brain runs the show. It coordinates all the processes in the body, including healing. I don't know how to eat a carrot and turn it into an eyeball, but my body knows how to do that. My brain knows how to do that. I don't know how to pull oxygen out of the lungs and put it into blood and pump it into the body and keep the heart beating and change the temperature internally and do all of these things that the body continues to do over time. All of those processes are determined by the brain and coordinated by the brain. So your spine must remain unlocked. In other words, there must be an absence of subluxation over time so that the body can continue to regenerate and heal. The moment that it locks up again or the subluxation comes back, a misalignment between segments in the spine that causes compensation, degeneration, interference in neurological function. The moment that that happens again, nerve function decreases, and so healing decreases, and health will begin to go downhill again. Next slide. Here's spinal subluxation. Again, interrupts the nerve signals between the brain and the body, which are basically what's determining how healthy you are. Absence of all nerve signals to any cell in the body is going to cause that cell to die. Absence of all nerve function in the body is death. Remember, your heart can stop beating, your lungs can stop breathing, but they're not going to pronounce you legally dead under most circumstances until there is no more brain activity, because the brain is the center for the impulse of life. That is what we understand as life in the body. So chiropractic problems are not necessarily back pain and neck pain and headaches. That is the result of a chiropractic problem, as is any type of health problem in general. The true chiropractic problem is the spinal subluxation that is interrupting nerve communication, or the ability of the brain and the body to communicate, causing a continual decline in health over time. The body cannot function normally if it is subluxated, if the spine is subluxated. So, correction of spinal subluxation restores coordination of nerve signals between the brain and body for optimal life and health. Again, regardless of symptoms, condition, diagnosis, what we are looking for is a subluxation. And we want to adjust that subluxation so that your brain and body can communicate normally, so that your body can restore health, so that you can live an awesome life, so that you can experience good health, and not just for you, but for your family and for your friends, because most people don't know this. And now that you know this and you've listened to me talk about it, you have an obligation to share it with other people. So I really appreciate your time. Again, the results speak for themselves. The benefits of care for the spine are just incredible in light of the healthcare challenges that we are facing in today's society. So again, I really just appreciate your time today and hope you have a great day. Bye.